Hi, I'm Dr. Kyla, paediatric dietitian, fussy eating specialist, and mum of two. I'm the founder of the online Mealtimes memberships that help parents just like you experience a confident and guilt-free way of feeding children. I'm also a business owner, a hot cross bun lover, and my superpower is finding things that you cannot live without. In this podcast, I'm talking about feeding your family, along with a random selection of topics that tickle my fancy. Welcome to Mealtimes with Dr. Kyla. Charlene Shoneye is an accredited practicing dietitian and credentialed diabetes educator. She started her career as a research dietitian at the University College London. She worked for Weight Concern, a charity raising the voice of people struggling with their weight, and in 2015 she won a scholarship to study her PhD. She's now a lecturer in diabetes and cultural aspects of health. I worked with Charlene years ago before I had my first baby at one of our Perth universities, and I'm delighted to welcome her onto the podcast to talk about gestational diabetes and some of the misleading and sometimes harmful narrative around sugar, carbohydrates, and diabetes. I loved this episode. It personally gave me a lot to think about as someone who's previously had gestational diabetes, and it's entirely relevant for you if you've ever had or currently have diabetes, if you have a family member with diabetes, or if you're worried about feeding your children sugar. I can't wait for you to listen. So welcome to the podcast, Charlene.
Oh, hello. I'm so happy to be here.
It's so nice that we could coordinate this kind of London to Perth chat at a time that works for both of us. And it's so lovely to have you here. It's really obvious from the introduction that I've done that you have considerable experience in the world of diabetes. And I'm really interested to hear about your passion for specialising in this area and kind of what led you to this point.
Well, I sort of started off in weight management as a research dietitian. And so there's this sort of relationship between weight and diabetes. And it really started to intrigue me because most of the clients I saw, living in a larger body and they didn't have diabetes. So I felt there's a bit of a mismatch between what I'd been told. And that led me to delve a bit deeper. And then in studying to be a diabetes educator, I really, really got excited about the science, particularly around how type 2 diabetes develops. And I guess I've never really looked back.
Oh, I cannot wait to hear more from you. So let's start with something personal. I had gestational diabetes with both of my pregnancies. And to be honest, I had very little knowledge of diabetes as a condition other than what we kind of learned at university, fairly baseline level. I'd worked in pediatric diet. Yeah, it's very small. And I'd worked in pediatric diabetes for, a couple of months as a new grad, but that was, a previous lifetime, really. I didn't have a lot of experience of gestational diabetes. But what I do remember was it was a real shock for me when I was diagnosed. I can remember actually exactly where I was. I was teaching a university class. We were on a break between the kind of lecture, and I had a phone call from my obstetrician, called them back, and they were like, yeah, just letting you know, if your diabetes test has come back to say, yes, you do have it, we're going to have to book you in with the educator and we'll need you to come to this. And I was just completely blown away. And it's interesting because lots of dietitians get gestational diabetes. I don't know if it's a curse on us in some way. But what was really interesting was when I told people about the diagnosis, like, I don't know why I would be immune to it, but when I told other people, the commentary that I got around that was like, oh, but you're a really healthy person. And like, look, I know, gross stuff. You're not overweight. Like, why do you have gestational diabetes? And it was quite a while. Like, what was that? 7 or 8 years ago now. And I was probably still caught up in a bit of that kind of anti-fat stuff. Like, it was harder to separate those things at the time. I definitely wasn't as evolved as I am now. And I felt the need to kind of defend myself or defend the condition or defend, weird stuff that comes up that you are just not ready for at the time. So maybe you can start, like, for clarity, why do some people get gestational diabetes? What is it about?
So I kind of talk about, I think, to understand how people get gestational diabetes or type 2, you've got to understand what a risk factor is. So risk factor is this feature that if you have it, you're more likely to get the condition than if you didn't have it, right? Yep. So, risk factors are things like the weight at which you were born, the glucose you were exposed to when you were in the womb, your ethnicity, your family history. And yes, diet and exercise are the ones that we always talk about, but there are so many risk factors. Okay.
Yeah.
And if you imagine each risk factor is like a lotto ticket, the more risk factors you have, the more chance you have of winning the diabetes lotto. Then nobody wants to win. But that's kind of a way to help understand it. So some people might have one ticket, just one risk factor, and they get gestational diabetes. Other people have got lots of risk factors, so they're more likely to get it. But we need to kind of take away some of the stigma and the idea that it's something that somebody has done to lead them to do it. Because some people are born with 5 or 6 lotto tickets, right? They're born with all of these risk factors. So it will take less sort of behavior change for them to get enough tickets to increase their chance of getting gestational diabetes or type 2 diabetes. Does that make sense?
That makes absolute sense. And I think that point of stigma is so true. Like diabetes is one of those conditions where the stigma is so high.
It really is.
Yeah, and pregnancy, brings out a lot of things for, women,
Oh,
particularly in your first pregnancy, let alone kind of some of these assumptions or commentary, or even just that your own personal risk factors are up for discussion from other people. Like it's a very weird
yeah.
dynamic, isn't
And
it?
as if they know your risk factors,
I
as if, the chit chat you're having if somebody actually has that information. It's an assumption that this particular condition is caused by this behavior. And people just don't realize that there are just so many things that can contribute to whether or not you end up with diabetes. And lots of those things are not in your control. And I remember, I don't know if you remember studying this, Kyla, but we used to study, we studied risk factors, and they were modifiable risk factors and non-modifiable risk factors.
Yeah.
And
You
in
can
the
get back to
modifiable
my
risk
content
factors,
there.
you've got like body weight, cigarette smoking, dietary intake, dietary quality, physical activity. And I would argue that those are not modifiable, and they're definitely not easy to modify. And if we look at the social determinants of health, and you think about things like income, health literacy, whereabouts you live, how many children you already have, what your living situation is like, how stressed you are, then actually your individual capacity to modify those things really varies between individuals. And so it's just not fair to use that type of language when we talk about who may or may not be at risk of diabetes.
Yes. And so much like blame that comes with it, right? That
Oh
you
my gosh.
brought it
Yeah.
on yourself in some way. And I guess this is something I see. I mean, I love social media for lots of reasons and I hate it for lots of reasons. And unfortunately, the commentary around diabetes in particular, weight, body size is so toxic and yuck. Can we put it out there? Like, can you prevent gestational diabetes or type 2 diabetes with a healthy diet?
I think the word prevention is not accurate, and I'm really conscious and mindful about the language we use in this space.
Love it.
So
Tell me more.
prevention implies that you can absolutely guarantee you're not going to get something, right?
Yeah.
And that's not quite true. Anybody can get any type of diabetes, regardless of what body size you are and what you're eating. What you can do is reduce your risk. And that's very different. That means you have a lower risk. And if you imagine, wearing a seatbelt means if you're in a car accident, you've got a lower risk of being seriously injured. It doesn't completely prevent you from being injured.
I love that example. That makes so much sense. Oh,
And I think it kind of gives people a bit of leeway, a bit of grace to say, I can do my bit, I can try, but actually I may still end up with diabetes. And if you have a strong family history, then that needs to be something that we can let sit with us. That needs to be something we can talk about and learn to be okay with, because it might be a condition that's in our family. So understanding your risk and understanding what you maybe could do to lower your risk might help some people feel empowered and feel that they have some sense of control. But at the same time, it can also attribute blame. And so we just need to be really careful about how we bring up that conversation and discuss what those things people might want to do to lower their risk.
that's such a good point because I do think there is such an insinuation that you are to blame or you have done something wrong if you
Oh,
have
definitely.
a condition like diabetes. And I mean, clearly that is incorrect, but that is just a prevailing assumption, isn't it, at the moment?
Oh, definitely. And I think that assumption comes from a lack of understanding about what exactly is diabetes. And because the language around diabetes and the management of diabetes involves sugar, blood sugar,
Yes.
sugar is in food, then we've made this sort of quick correlation or assumption that one thing has caused the other. And that's really not the case.
There's very much an assumption that you eat too much sugar, you get type 2 diabetes, right?
Oh my goodness. And it's so hard to unpack. So I teach health professionals about diabetes. And so they're all, wonderful clinicians. But somehow this message that sugar equals diabetes or carbohydrates, too
Yeah.
much carbohydrates, or white rice is another one I've seen causes diabetes.
Bananas, because they
It's,
have more sugar in them, you know?
yep, we should eat the green banana, not the ripe one. And to kind of think that you could narrow down this really complicated endocrine disorder to one characteristic or one food is really quite ridiculous. I mean, it's just such a big and complex condition that there is no one food or no one characteristic that really is going to determine if you get diabetes or not.
And maybe I should have asked you at the start, but can you tell us, like, what is diabetes in an easy to understand kind of way?
So, when we think about what diabetes is, essentially it means that your blood glucose levels are too high, or there's too much sugar in the blood, and you need an intervention, whether that be a medication or a lifestyle intervention, to bring that glucose or that sugar level back into a normal range.
Makes clear sense. Can we cure diabetes or reverse diabetes with just diet?
No, no. And there is no type of diabetes that can be cured or reversed. We really need to, again, be quite mindful about the language here and make sure that we're accurate. So to reverse or to cure means that we're undoing something, right? So if you've broken a bone, you could, put it in a cast and it grows back. And it is as it was before it was broken to some degree.
Yep.
Diabetes, that is not possible. What we do have for diabetes is remission. And remission really indicates that the condition is dormant and that the symptoms are no longer prevalent, the treatment is no longer required, but essentially the condition is still there. And the only evidence we have of diabetes remission is for type 2 diabetes.
Right. So if you have gestational diabetes, it is not something that you can put into remission.
And no, there's not. And the way that some of these posts on social media talk about diabetes remission or reversing diabetes, particularly during pregnancy, is really, really dangerous. So if you're getting any information about diabetes, gestational diabetes, from social media, you've got to really be careful to look at the credentials of the person you're getting the information from, and also to check whether or not they have an underlying cell. So if they're going to tell you that you can reverse or put your gestational diabetes into remission, and then they're selling you a product to do that, I would run a mile and avoid them totally.
Just can't believe that that's even an option that people can put that out there, because clearly the words that you use, the things that you promise, if you don't have experience in diabetes, you don't know that that is selling, something false or selling a false idea. And how,
Absolutely.
oh,
And a diagnosis of gestational diabetes can be devastating, heartbreaking, shocking. It brings up so many emotions that people are, obviously going to looking for some sort of hope, looking for some sort of support network. And that's what's being offered here. And so it's totally understandable if people are looking for that, clinging to it, and wanting to believe that it could really help.
yeah. Oh, people, how can this be? I guess if we're talking about kind of inappropriate things being sold or taught on social media, and I guess this is something that I see commonly even in posts that are not specifically related to diabetes, but there seems to be a surge of information at the moment, misinformation about sugar, carbohydrates, spikes in
Oh,
blood
gosh.
glucose. there's a whole like movement that has taken a lot of this stuff out of context. Can you give us a bit of a summary of the landscape, I guess, around
It
what
is,
kind of messages that are coming out and how incorrect they are?
oh, it is unbelievable. And I'm not sure exactly where it come from or how we got here, but we really need to start undoing some of this narrative. And there's two key things here. One is that carbohydrates are a problem, and
Mhm.
carbohydrates are, causing inflammation, toxicity, and disease. For me, as a person, I'm a woman of color. My parents are from the Caribbean and Africa. My husband's family is from India. That's giving me colonized vibes. Your food isn't good. Your food is dangerous.
Yeah.
Um, and it's simply just not true. Most people in the world eat a diet that's based on carbohydrates. And when we talk about carbohydrates and we talk about sugar, I mean, I would say, well, which one are you talking about? Because there's dozens of different types of carbohydrates, and there's dozens of different types of sugars. So if we really want to, be scientific, we need to be accurate. And people just don't eat one food in isolation.
Yeah.
People are not typically, oh, I'm really craving sugar, and so you eat what, a few tablespoons of honey.
Yeah.
No, people eat a donut or an ice cream or chocolate. And that has a combination of sugar and fat, which is delicious and it's palatable. And it, sometimes brings back happy memories, and it's a way that we celebrate and enjoy things with people. And so to demonize one particular food and label it as causing all these disease is really, I guess it's this diet culture, and it's this need to have things that are good or bad.
Yes.
And really, we can't categorize foods so simply because they are complex, and the relationship between food and any disease, whether it's diabetes or heart disease, comes from the patterns of eating, for one. It's not just one food, it's a pattern of eating over time. And it is only one risk factor of many. Like I talked about with these lottery tickets. There's diet, there's smoking, there's sleep, there's poverty. There's loads of risk factors. And so we don't need to focus on diet. And as a dietitian, sometimes I think we've overemphasized the importance of diet or the role of diet in some conditions.
I
We've
agree
gone a bit too far.
wholeheartedly. I think overemphasize the role of diet in life. Like I
That
think
it's
it's
yeah,
important, but it's not the be all and end all. Sometimes I see people, driving themselves into the ground trying to perfect their own diet or their kids' diet, and it just, I think,
it's
causes more
never
harm.
ended. Like you might get one meal and then it's on to the next meal and then the next meal and then you go to a wedding or a celebration. And I just think we just need to have a bit of a more relaxed approach, and a bit more of a realistic approach. So this whole thing about, as my daughter's birthday party, she's turning 3, I offer someone a piece of cake at the party. And they look at me as if I've like offered them, some sort of illicit drug. And she says to me, oh no, I don't want to spike my insulin. And I've really just had to take a deep breath and just give the cake to someone else because I thought
You're like,
I'm
I'm
not
not
going to
at
get it.
work now.
I'll eat the cake. And I just thought, how fortunate are we that we can eat the cake and our insulin will spike or increase, whatever language you want to use. Our body will notice that there's a higher level of glucose. It will produce insulin and move that glucose from the blood into the cell. That is an absolute privilege. And for many people living with diabetes, they're trying to achieve that increase in glucose and increase in insulin, sorry. They're trying to get that insulin through medication, through having to inject insulin. It is a normal part of human physiology. It is nothing to, if you don't have diabetes, we don't need to panic about it. We don't even need to talk about it really. We just need to have an understanding, I think. We need to be aware of which foods contain carbohydrate. We need to have some nutritional knowledge. But I think we need to chill out a bit.
Yeah. It's interesting. I'm seeing this like trend, and I think you can just buy them now of this constant glucose monitoring, like something you can
Mm.
attach to your body to track your blood glucose level to kind of like optimize it. And that just, where has that come from?
So the continuous glucose monitor has been around for over a decade. And it's used for people living with diabetes. It's a really valuable tool, and it can really improve the quality of life and reduce the need to prick your finger to test your glucose levels. And it gives you a pattern of glucose rather than what your glucose is at that individual moment. So it
Right.
is a fantastic tool to help people with diabetes. And essentially, that's where it's come from. What we're seeing a lot of now is people eating a single food, um, and then looking at what it does to their blood glucose levels. And, so they're saying, okay, I had a piece of watermelon. My blood glucose has gone up and it's spiked. And that's a problem. We need to, avoid these spikes. But what they often don't highlight is that yes, the glucose has gone up and it's come back down. If you
Yes.
don't have diabetes, you eat, the glucose goes up and it cannot come back down, which is the definition of diabetes. But the fact that it's gone up and it's come back down, it's normal physiology.
And it's like
It's great.
measuring what your body is meant to do and then making a problem out of it, right? Trying to
Yeah,
create this false experiment of just you looking at one food and not kind of understanding that that is part of normal physiology, that is meant to happen. And it is not something that we need to monitor or control. Our body does that.
our body will do that all by itself. And the other problem with that is I think it creates this hierarchy of food. So I had salmon and broccoli with, flaxseed sprinkled on top. And look how stable my blood glucose was. Look how I didn't have a spike. But not everybody has access to that food. It's not appropriate for everyone's culture or preferences, and it's expensive. And so that's my other concern about some of this noise around foods that might spike your blood glucose is that it might, or it does, demonize certain foods and create this hierarchy of which foods are good or best. And if you don't have access to those foods, or those foods are not culturally familiar to you, it can really lead people to feel that eating well, being healthy is outside of their reach. And
Yeah.
that's really, really problematic.
It's this real assumption that there is one way that is best to eat, right? And that it is related to your blood sugar, to your insulin. Like people are drawing links that are not proven. Like that is not actually the truth. And it's being
No,
sold to a lot of people that like this is what you need to do for health. And I just don't understand how we got to this point because I saw a post recently by a dentist who was saying like not many people know about these spikes from carbohydrates and like this is why it's a problem. And I like almost choked on my lunch. Like anybody who knows anything about physiology knows what happens when you eat carbohydrates and what happens to blood sugar. And that is part of normal physiology. The fact that it's being cast as something to fix or something to avoid, just I find mind boggling.
well, I think for people who are living with diabetes, so if you have gestational diabetes, then you'll get to see a dietitian or have some education, and people will support you to understand how you might adapt your diet, your lifestyle, your medication to minimize having very high levels of glucose in your blood. And I think that, people have taken information out of that context and put it into into the public health domain as something that everybody needs to know, everyone needs to do. And that's where I think some of this misinformation has come from.
Yes, that makes sense. So it's like literally just taken out of context, cherry picked from a condition where that does help and just applied to somebody who doesn't have diabetes.
Yeah, yeah. And I think it also feeds into people's desire to be perfect or to be good when it comes to food. And I think it fits that narrative beautifully. And now there's data to support it. And that's really encouraged people or drawn people in.
Yeah, that makes sense. So is there then a link between carbohydrates and sugar and maybe firstly body weight or body size? Is there evidence that there is a link there?
So when it comes to body size, the relationship between carbohydrates or sugar is really about overconsumption. But that could be the same for any nutrient. So overconsumption of fat, overconsumption of. So that there isn't any real relationship to say that carbohydrates can magically create fat and make somebody's body bigger. Like it just isn't true. And if you look globally at some of the blue zones where you've got most of the world's most centenarians, I can never say that word.
Yeah.
People living over
Older
up
people.
to 100. And you look at places like Japan and Costa Rica and Sicily, their diet is 60 to 70% carbohydrates. But the key, and so we know that it's not carbohydrates that are driving disease. We know that it's not sugar that's driving disease. There's no one particular food. In some cultures, they're eating lots of carbohydrates, and in other cultures, it's natural to eat less carbohydrates. I think we've really overplayed the relationship between carbohydrates and body weight. And I hear people say things like, I just have to look at a slice of bread and I've gained weight. Like, really? Like, let's just unpack what's happening here. And let's take away the morality from gaining weight. Because I think being bigger, accumulating fat is automatically seen as awful, bad. It's the worst thing that can happen and something that we absolutely need to avoid. And I think if we take that out of the equation and we just look at the food for what it is it something you enjoy? Does it align with your culture and your values and the way that you want to feed your family? Is it nutritious? Can you afford it? And just sort of take away some of the judgment and the
Yes.
expectation that food is going to provide all of these things, where actually it is just food.
Yeah. I feel like carbohydrate and sugar, and probably sugar and carbohydrate as a part of that is
Mm.
like the villain of this decade. And it was fat
Like it was fat when
previously.
we were growing up, like low fat this, low fat that. It's now
Yeah.
low carb. Do you know, I saw a packet of prawns in the supermarket, just plain prawns, and it had on the packet a low carb food with a tick. I'm like, what is happening to the world? These are
I saw one
prawns.
at the checkout yesterday that was low carb chocolate. And
Oh, yuck.
I know. I'm like, is this just a variation? Like, I guess sugar, it's been like low sugar, sugar free, all the sugar replacements are obvious kind of hype at the moment. Is there like any evidence for developing type 2 diabetes linked to sugar specifically or carbohydrates?
No, so the only the closest thing we have is sugar sweetened beverages. And again, this is a risk factor.
Yep.
It's not, that sugary drinks cause diabetes, it is a risk factor. And when we look at large studies, so we're looking at thousands of people from different cultures, different parts of the world in systematic review, meta-analyses, we can see many risk factors. Some of them increase the risk of type 2 diabetes, and some of them lower the risk. So sugar sweetened beverages are one of the factors that have an increased risk, but they don't cause type 2 diabetes.
Do you think sugar sweetened beverages can be singled out because they are like soft drink is something that people either tend to drink or don't in a way that doesn't apply to other food groups or other foods?
Potentially, I don't, but I have to also say the risk isn't huge. So it's not as
Yeah.
if, people are so much more likely to get type 2 diabetes if they drink sugar sweetened beverages. The risk is fairly small. I think there's some socioeconomic factors related to high consumption of sugary drinks.
Yep.
And there's maybe some other associations or other behaviors that come alongside sugar sweetened beverages. And we know that dietary data in itself is really challenging to
Mm.
collect, and there's lots of inaccuracies. So I wouldn't say you got to throw the sugar.
Yeah,
I occasionally have a sugary drink. I
absolutely.
wouldn't say that it's detrimental. We need to avoid it at all
Thinking
costs.
about
It's
why
just being aware.
why it had been singled out, and I guess that's the link that people are using to say, like, if you have too much sugar, like, is that where that kind of myth has come from, do you think?
I think
Is
it's
it
come
just
from.
because diabetes is about blood sugar and therefore,
I think it's as simple as that. And I
mm,
think the marketing around low sugar products for people with diabetes has just expanded into the mainstream market for everybody else.
Right.
Like
So it's
I
almost
really,
like a treatment, but it could be the cause. Like if you're treating something, you're assuming
exactly,
that's also the cause of it. Yeah,
that's
wow.
also the cause.
That
And so
is so
let's take
damaging.
it away.
So damaging. How do you, this is a question I haven't posed to you, so I'll put you on the spot. How do you think about sugar in terms of feeding yourself and your family? Is it something that you consider? Is it something that you put value on? What's your kind of take on it, thinking about children and yourself?
Yeah, it's not really on my radar, to be honest. So, look at my cupboard now. We've got some marshmallow cereal that my husband saw on special and bought for the kids. And there's something that they might have, and I look at it and think, oh, it looks disgusting. But yeah, I really want to create an environment where all foods are foods.
Yeah,
And particularly because I have a really, really strong value for traditions and culture when it comes to food. That is my passion. So I am particularly giving of foods that have a cultural significance, so I love Easter eggs and
yeah.
candy canes and coconut candy or coconut drops, which is, uh, a Jamaican food, which is just sugar cooked down and then you add tons of coconut to it and let it dry.
Oh,
It's delicious. And I really want my children to savor and enjoy those foods as part of their culture and as part of our family dynamic. And so I don't particularly talk about sugar. It's not really on my radar, but I
yeah.
am conscious that other people talk to my children about sugar. And so I sometimes feel like I need to do a little bit of damage control.
Yeah.
Um, so I remember buying my daughter a giant, giant fairy floss, like huge, bigger than her head. So excited. And someone's like, "Oh, I'm really surprised that you're giving your daughter candy floss. You're not worried about diabetes." And she kind of looks at me and she looks at the lady and she's like, "Nah, and she says something along the lines of, all foods, something like all foods are fine and all foods have things that are good for you. And this one is delicious." And I was just like, yes, I'm so proud
Best
of you. I'm so
girlfriend.
happy that you
Yeah.
can just defend your fairy floss and eat it in peace.
And enjoy it without that sense of guilt or shame that's been forced upon so many people eating.
Just,
Oh,
yeah, we
I,
really need to get rid of the guilt. And, the guilt is detrimental. If you are trying to make changes to self-manage diabetes, self-manage any chronic condition, the feeling of guilt and the shame that comes with that is absolutely detrimental. And so that goes for people talking to colleagues, friends, whoever about their food. Shame and guilt is not going to help them, and it's not going to help you. Like it is, there's just no place for it.
there is no place. I feel very similar to you. I don't think about sugar as a thing. I don't talk to my children about sugar. I serve a variety of foods, some of which are high sugar foods, some of which probably don't have a lot of sugar in it, but it's not a driving factor in. I don't spend time thinking about it. I don't take them to parties and stress about what they're eating. I don't tell them to eat real food first. And
Mm,
that is something that I think is so beaten into people through social media, through our own experiences of being parented and what the world says. There's such villainization of, I don't even know if that's a word, but it's
yeah,
seen as this thing to control and an enemy. And maybe what would you say about kind of controlling sugars if you have been diagnosed with diabetes? Is it something you have to manipulate and control?
so if you have been diagnosed with diabetes, or even if you are aware that you are at an increased risk, so maybe you've had gestational diabetes, if you've got a strong family history, then I think it's important to be knowledgeable about which foods contain carbohydrates.
Yeah.
So, really talking here about being informed and being educated. So, are you able to identify which foods contain carbohydrates? And are you able to look at a food label to make an informed decision about which, so if you're looking at crackers or you're looking at breakfast cereal, can you identify which one of those products align with the one that you want to choose?
Yeah.
So my view is really about empowering people to have that to have that skill set so that they can make an informed choice. And the other thing I'd really want to, I guess, message to get across is that aside from diet, there are some really key things that you can do to reduce your risk of the diabetes developing complications and progressing. And some of those things have got nothing to do with food. But I think sometimes we forget to support and educate people to do that. So if I could just mention those three.
Please hit me.
Okay. Well, the first one is to make sure that you know your numbers. You can have a HbA1c test, which is your sort of average glucose over the last 10 to 12 weeks. If you have had a oral glucose tolerance test, I've said to people, what were your results? Oh, they were fine. No, you need to know, what were your numbers? What was the test done? What were the results? And has that changed since the last time you had the test? So if you're having an oral, if you had one with the last pregnancy and you had one, after the baby was born, and now you're having another oral glucose tolerance test, ask your practitioner how your numbers have compared to the previous one. Because diabetes is something that is progressive. So you're looking to understand what your numbers are and identify any patterns. The second thing is to consider what medications you're taking. So particularly for diabetes, people are very, very bad at taking the medications as prescribed. So maybe you've been prescribed metformin, but you don't have any, which is typically the first line medication that can help reduce the risk of diabetes or lower glucose levels as a first line treatment. About 60% of people do not take this medication as prescribed. So if you have been prescribed the medication and you're struggling to take it, have a chat to your pharmacist. Maybe there's a different formulation that can be provided or some support to help you take the medication more accurately, as prescribed. Otherwise, it really just doesn't.
What makes it hard for people to take that continuously? Is it side effects, or is it a lack of understanding about what it does?
Oh, I think it's definitely those things plus many more. So definitely, I think most people don't understand why they need to take it. They had no symptoms of high glucose levels, no symptoms of diabetes. And so you can sort of forget about it. Or some people don't even believe that it's real or believe that the test was accurate.
Right.
Maybe nobody explained what type of diabetes they have, why they've been prescribed the medication, how the medication works. The medication can cause some tummy upsets, and people often maybe don't realize that there are alternative formulations of the medication, and so they just stop taking it without letting the prescriber know they've had a side effect so it can be reviewed. Right. So there's, and then in addition, people are just busy, right? You're looking after children, you're keeping your house, you're going to work, whatever it is you're doing, and people forget.
I was like shocked then, but also this was me who couldn't take an iron supplement every day despite having low iron levels. So it is just symptomatic of all the things that we are doing,
All
going, thinking of, all the things. So the first one was
I've got vitamin D.
Yeah. I still
here.
Covered too. So first one, know your numbers. Second one, take your prescribed medications and talk to your provider if you have side effects. Number three
is see a diabetes educator. If you have some concerns, lots of diabetes educators will take a self-referral and get yourself an individualized assessment and plan. So we can, see an Instagram post and think, oh my gosh, I eat that all the time. I've got that family history. I'm at risk. But to have an individualized plan that encompasses your history, your numbers, your medication, your life experiences, and your goals, then a credentialed diabetes educator can really, really help you unpack what that means and give you some personalized advice. And a diabetes educator could be a dietitian. And if you're, I'm a dietitian, so if you're wanting to work on those dietary goals, then finding a diabetes educator who is a dietitian can really support you. And when I talk about goals, I'm not talking about macronutrients or how much you weigh. I'm thinking about, what do you want your meal times to look like? Like, what do you vision your sort of, when you picture feeding your family? And so, for example, you might say, I really want to include traditional foods that I ate growing up, but I'm worried about how that might impact me, or I'm not sure if they're healthy. Or maybe you really want to eat more plant-based foods or home-cooked foods, and you find your schedules, you're really struggling to do that. A dietitian who's a diabetes educator can really help unpack your goals alongside your personalized risk or values from the tests that you've had done to help you understand what's happening in your body, and empower you with some tools in your toolkit to manage that.
That is such great advice. I already need to go back and check my numbers from point one and reflect on that. What about if you are a woman who has had gestational diabetes in the past? Do you need to be focusing on carbohydrate or sugar content of the food that you feed your children for their future risk?
This is really, really hard, okay?
Yeah.
Because you get diagnosed with gestational diabetes and you're told you're at high risk of developing type 2 diabetes yourself, and so is your baby. Like, it is really, really difficult to be given that news when you're pregnant and already have so much happening. And so, first of all, I'm kind of sending a big hug and reassurance and support to anyone in that situation, because it is really, really, it's really difficult.
Yeah.
When it comes to things that you can do in terms of feeding your family, really mindful about, any sort of, you know, particular foods or approaches that can reduce or not reduce your risk. We really just want to be mindful of the guidelines that we have for being physically active,
Yeah.
for alcohol consumption, Australian dietary guidelines, and prioritizing sleep. Right? So I don't think there's any special things that we need to do in terms of carbohydrate and sugar, and certainly not for children.
Yeah.
And one thing I also want to highlight is that when we think about dietary risk factors, we often talk about things that can increase the risk. So there's talks about sugar sweetened beverages or, high sugar foods. White rice sometimes comes in the firing line. But what we often don't talk about is that there are so many foods that are protective and that lower the risk. And I think it's always more helpful to think about things that you might want to add or eat more of rather than things that you want to avoid. And naturally, if we eat more vegetables, fruits, nuts, seeds, it's likely to displace some of the other foods anyway. And it's a much more positive and fun way to approach how you might want to create a dietary pattern that really reflects the goals that you have.
I love that.
Yeah. And there's nothing out of the ordinary. The things that
Yeah.
we can do to increase our risk. It's more fruits, more vegetables, more whole grains, more nuts, more seeds. The things that have been shown to increase the risk are sugar sweetened beverages and processed red meats. And I'm not going to jump on the bandwagon about bacon and ham because we've already had enough of that with the lunch boxes.
Oh, honestly, a
Because
ham gotcha. But again, we're taking one food, right, and
one
demonizing
food.
it to the point of just like, let's think about overall balance and just that non-sexy message of moderation, eating a variety of
So
foods, enjoying your food, taking time to sit down and have it, all of the things that you don't need to sell necessarily. You don't need to buy into these specific ideas that somebody's not telling you something about a particular food or
no,
nutrient. Like, it's just all way too complex. We just don't need to go to that extreme.
no, no, we absolutely don't need to. And
And I
and
would
it's
say it probably causes more harm. Would you agree?
oh, definitely, because
Emotionally.
stress and worry, and then this sort of weird sort of like, how do you then socialize with your friends? How do you have downtime if food is a cause of stress?
Yeah.
Like, it just becomes so problematic and becomes bigger than it needs to be.
And so
And the
unnecessary.
it is, but I think we also need to be realistic in that some people will develop type 2 diabetes.
Yes.
And if you've had GDM, it's more likely to be you. And so if if that diagnosis comes, What I really would be sad about is people then lamenting on the foods that they've eaten and how they've brought it on themselves. We really need to normalize that if we're privileged enough to live longer, then we are going to accumulate chronic disease.
What a
Like
great way of explaining that.
it's going to happen, And I look at my own. I've got polycystic ovaries. My BMI is over 25. I'm a woman of color. I've got a family history of diabetes. I'm a dietitian. I'm a diabetes educator, and I am aware that I am likely to develop diabetes. Like I've had many tests done. I don't have it yet, but it's a possibility for me, and I think we need to be okay with understanding what our family history is and what our possibilities might be. We don't need to sit back and say, "Yeah, I'll do whatever I want. I'm going to get diabetes anyway."
Yeah.
Absolutely not what I'm saying, but we need to be informed about our personalized risk factors and have some level of acceptance.
Such balanced advice. I love that.
Yeah, I think it's an easier way to approach it. And a way to really, like, I love eating.
Yeah.
I go to bed at night and I'm already thinking about how much I'm going to enjoy the prawns I'm going to have for dinner the next day.
The low
I'm looking
carb
forward to
prawns,
that.
though, don't you know
Probably in my fried rice. Um, and I just wish everyone to have the same level of pleasure and enjoyment from food.
Yes.
And I think I'm a bit lucky in the sense that in my culture, um, my dad's from Nigeria, it is not ideal to be slim. Like it's
Yeah.
not seen as attractive, it's not seen as healthy. Anything less than a sort of size 12, size 14 is like, oh, are you okay?
Yeah.
And so I think I've grown up without this sort of pressure or lens that's looking at my body.
Yeah.
I had a bit of freedom from that. And so I think that's something I really want to put through in my work, put through in my social network, and really impart on my children is this neutral approach to your body.
Yes.
And to kind of take away some of this link between our body and our health.
Yes. Yeah. I second. And I mean, obviously, what I do in this space around baby meal times, toddler meal times, family meal times is all about laying that foundation for a life that is free from fear of food or feelings of guilt and shame and worry around what you eat. I just don't think those things, I mean, we know those things don't serve us, those emotions don't help us even eat a healthy diet. And so I wish that for everybody as well, that it is
Yeah.
comes without any of that blame stuff, that you can actually enjoy a wide variety of foods. You can make room for all foods. There is nothing that is going to poison you. And you can be aware of your risk factors, absolutely. But you also don't have to live a stressed life around food.
No, and also just to, from a scientific point of view, the fat that's stored around your bottom and your hips and your thighs is not correlated with getting diabetes.
Yeah.
Like there's a very particular type of fat that is stored around the pancreas and the liver that you cannot see, right? And so there's no set amount of fat that is driving diabetes. The kind of threshold is individual for different people. So this idea that the fat that you can see or the dress size you wear is a determinant of your risk for diabetes is actually false.
Wow.
Like it's just not true. And if you look at globally, so for example, if you look at somewhere like Vietnam, the average person with type 2 diabetes is about a size 10.
Yeah.
Okay. So the threshold for fat around their pancreas and their liver and the other risk factors that are in that environment has led to that population getting diabetes. And we really need to educate ourselves about the science. And I'm talking to health professionals here,
Yes.
people that are educating people around diabetes, really kind of seek that education around the science so that you're accurate in your information, because all of us are susceptible to this misinformation that we get and the stereotypes and the stigma. All of us are soaking those things in. And so we have to counteract that. We have to actively counteract it, because if you do nothing, you'll be perpetuating that stereotype and that stigma in your language, and it will be subconscious.
Yeah, I can absolutely see that. Oh, thank you so much for sharing that. That was so easy to follow and understand, and something that like has the potential to be quite complex, but doesn't have to be again. I think that's so powerful for people who maybe have had gestational diabetes or have type 2 diabetes who don't, who are educating those. I think that applies to so many people. So thank you so much for your time. Is there anything else you want to put out there, clarify, add in?
I'd say thank you. I enjoy talking about diabetes. I enjoy talking about food. So it's a real privilege to be able to share what I have learned. And anything I guess I'd reiterate is to seek a diabetes educator.
Yeah.
Um, Find one local to you, book an appointment. If you're concerned, if you've got questions that you don't feel are being adequately answered by your healthcare team, then seek a specialist who can give you that support.
Great advice. Thank you, Charlene. I really, really appreciate your time and your expertise in this chat.
Yeah, thank you, Carla.
A huge thanks for tuning in and listening to my podcast. This is all brand new for me, so I'd love to hear your feedback. Give me a review or send me a DM. I'd love to hear your thoughts. And above all, I'd really love you to hit that subscribe button to keep listening. Thanks.